From International Geneva, we connect researchers, policymakers, and practitioners, and we try to create spaces like this one, where evidence and practice can speak to each other. The Research Café is a series designed to do exactly that, to bring ongoing research into accessible conversation with a diverse audience of students, academics, policymakers, and practitioners, and to give us all the space to ask questions and exchange. Today, the Café is titled the Global Governance, Climate Change and Health. What does the literature say about its evolution, weaknesses, and priorities for change? It is based on a recent paper co-authored at the Global Health Center that maps how global climate and health governance has developed, where the gaps are, and what might need to change going forward. I'm very pleased to introduce you Eva Greenup. She's our speaker and a dear colleague of mine. Eva is a project associate with Governing Pandemic Initiative at the Global Health Center, where she works at the intersection of pandemic governance, global health, and international policy processes. She has a master in public health and experience spanning global health governance and pandemic preparedness and more. In her work, she focuses on stakeholder engagement, knowledge exchange, and event coordination. The format for today will be Eva to speak about her work and Laura's work, about 25 to 30 minutes. Then we have Q&As, and please, during the Q&A, state your name and affiliation in order Eva and everyone in the room and online to know who you are. With that, please join me in warmly welcoming Eva Greenup.
Thank you, Antigone. So thank you to people in the room and online. Yes, this is the title of the presentation today, The Global Governance of Climate Change and Health. What does the literature say about its evolution, weaknesses, and priorities for change? I want to say thanks to Laura, who might be online or might be joining later. I couldn't have done it without her. And thanks to also Suri Moon and Daniela Morich, who read many iterations of the paper and got it to where it needs to be today. So here's the outline of today's presentation, and we'll go straight into it. So first, the introduction. So why did we do this paper? Well, we did it to take a historical view of how we got to the current climate health governance landscape. And how the integration has occurred, so climate into health and health into climate. And then to look at the literature and the recommendations that came from that. And why is it important? Well, it's important to know what's been done in the past, to know what can help in the future and where we're going, and also to see what common repeated recommendations came from the literature. And the output was, as Antigone said before, a publication, which is in two parts. So the first part is the historically informed evidence-based analysis, and then the second part is the literature review with actionable recommendations taken from it. So now we go into the next part, methodology. So as previously said, the first part we looked at reports, documents, resolutions, declarations from the WHO, UNFCCC, and others, and these were mapped and evaluated. And then we did a comprehensive literature review, focusing on climate change, health, and governance using two primary databases. And once we analyzed the outputs, we then put that into a LibMaps tool, which captured other articles that weren't initially captured in the search. And we ended with 567 articles that we reviewed and categorized. From these articles, 4 themes emerged, and we extracted 4 actionable recommendations from these. So now we go into the structures for global governance of climate change and health. So we have the UNFCCC, the United Nations Framework Convention on Climate Change, and its yearly Conference of the Parties, COPs, and then the WHO World Health Organization and its yearly World Health Assemblies, and then other key players as well. So to go into the UNFCCC, Firstly, I know some of the slides are dense, so I won't mention everything, and we can come back to it if you would like at the end. So firstly, the UNFCCC was established in 92 and adopted in 94, and health was referenced, but wasn't really looked at in detail, and you can see the two articles on the screen where it was referenced. And then we go to the Kyoto Protocol, which didn't enter into force for 8 years until 2005. And this was important because it set legally binding emission targets on 37 industrialized countries who had historically emitted more, contributed more to climate change. And then we go into 2010 and we have the establishment of national adaptation plans. And although not initially for health, it was the earliest formal entry point that health could be included into the climate arena. And then we go on to the Paris Agreement, which I think most people know, even if they're not in the climate sphere. And the inclusion of the right to health in the preamble, which is extremely important in the recognition that climate change is affecting health. Also in the Paris Agreement, we have the nationally determined contributions, NDCs, and these are countries' strategies and plans and how they're going to progress to meet the Paris agreements. And these are updated every 5 years. The latest update is this year, right now actually. And to my knowledge, when I last checked, as more are coming in through COP30, 110 countries have now submitted their updated NDCs. And then the global stocktake, which also happens every 5 years, and the last was in 2023. And this was to look at the progress, how we're going towards the goal of limiting heating to 1.5 degrees. And no surprise, we are not on track, and we need to accelerate our action more. And then we go on to the special report on health and climate change from WHO. So this is also signifying how climate change is being addressed more in the WHO side. In terms of the special report on climate and health, we have 2 more in 2021 and 2024. And they all have similar themes of including health in climate strategies and having international and cross-sectoral collaboration. One thing I'll mention as well is the previous slide was a span of more than 30 years, and this is a span of 5 years, just to emphasize how much more health is being considered now in the yearly COPs. So we have in Glasgow the Health Pavilion, the first one, and that's continued since then, and it's a space for health discussions and activities. And then from that Health Pavilion, there was a commitment from more than 50 countries to build climate resilient, low carbon health systems. And from those commitments, the ATTACH was launched, so the Alliance for Transformative Action on Climate and Health, which I'll discuss more later. In COP28, we had the first Health Day and the Declaration on Climate and Health, which was an extremely important milestone for the health community, the climate health community. The declaration was endorsed by more than 150 countries, signifying political consensus and the need to increase action on this important issue. And then in COP29, I go to the COP Presidency's Continuity Coalition for Climate and Health. And what this is the coalition of the last 5 COP presidencies from COP26 to COP30, with an agreement to try and mainstream health in the UNFCCC climate agenda. And leading from that, we have COP30 happening right now, and that's what Brazil is aiming to do, particularly with their Bellum Health Action Plan, which will be presented next week at the COP. And they're aiming for it to become a global reference for strengthening climate resilient health systems. So the plan looks at health equity, social participation, and also intersectoral collaboration. So next we go into the World Health Organization's role in climate and health. So we start with awareness in the early 2000s. And this first report here, the World Health Report, recognized climate change as a threat to health. And then the technical report underneath, released in 2003, which is actually an extensive book, went through all of the possible effects climate change could have on health. And the wording was quite different there, possible, compared to what we see now. And then we had a resolution on climate and health, and I'll speak about resolutions on the next slide. From the 2010s, we had the integration and adaptation. So we had different assessments and guidelines from WHO on how to effectively introduce health into climate strategies. So like the health NAPs, Health National Adaptation Plans. And then we also have the climate resilient health systems. And I point that out because the language changes when you come to 2020 in terms of the guidelines and the focus. So it changes the climate resilient and low carbon health systems. In 2020 as well, we have more quality criteria and updates on the assessments to help countries incorporate health in their climate strategies. And then, as I've said before, the ATACH was formed from 2021 and established in 2022. ATACH from this October has 100 members now, and it's a alliance where WHO first helps countries to achieve their climate goals, but also there's knowledge sharing and help with access to finance as well. And then finally, we have now, over the last year or two, global coordination. And so firstly, for the 14th General Program of Work for WHO, climate change is one of the 6 key pillars that they're trying to address, signifying how of important issue it has become. And we have the resolution there on climate and health, which led to the Global Plan of Action. And then the NDC quality criteria. So again, how to effectively integrate health into climate strategies. So we then go on to the resolutions. So the first resolution in 2008 on climate change and health formally recognized climate change and health and the need for more action. It encouraged adaptation, monitoring, and encouraging international cooperation. The second one in 2015 was on air pollution and looking to align policies and demonstrating also how the health benefits of mitigation. And air pollution is a very key example of this because you see the effects quite quickly. If air pollution is decreased in a certain area, public health benefits are seen. And that's also why when there's clear cause and effect and evidence behind it, more resources can be put towards it. And air pollution, again, it's a big example and a lot of resources have been put towards it for that. And then the 2024 Climate Change and Health Resolution, which advocated for strengthening WHO climate health actions, bringing climate considerations into health systems, and then also the Global Plan of Action, which asked WHO to produce, and this was then adopted the year after. So the Global Plan of Action has had 3 main calls to action: sustaining the momentum in climate and health, which I think we need to, especially seeing the last few years, how much this is increasing. Integrating health into climate policies, so very much echoing the WHO special reports on climate change and health. And maximizing health co-benefits in mitigation and adaptation strategies. Again, back to the air pollution example, but of course there are many others. And then the action areas, underneath each action area, there was key tasks and recommendations for different groups. So for member states, WHO, and relevant stakeholders and civil society organizations. So next we go to the Intergovernmental Panel on Climate Change. And this is the UN scientific body that looks at climate and science. And the first report that they did, there was no mention of health. And you can see with each subsequent report, and as more evidence has been produced, health has been included more and more. And the most recent report, health was a central theme. Extensive recommendations were given, and it promoted international collaborations. I'll say international collaborations and intersectoral collaborations will be a key theme throughout the presentation. And then we go on to The Lancet, which is an academic journal, and they established the countdown on health and climate change in 2016. And this was to track government's progress towards the Paris Agreement commitments. And we see that climate change and health monitoring has changed, and there's the need for new innovative indicators, which is reflected in the fact that in 2016 there was only 40, and now in 2025 there's 57. And then another point is the number of collaborating institutions and researchers, which was 24 in 2016 and is now 128. Very much reflecting that with each subsequent issue, they were trying to get data from different regions and trying to create studies or data that was more generalizable. Of course, it can't be fully generalizable to the whole world, which they also acknowledge, that there are in resource-limited settings, there's not enough data, and we need to improve infrastructure and capacity, not only to be able to monitor, but also to look at missed learning opportunities from these areas. And also, our paper went till 2024, but I just wanted to note the 2025 report has just come out. And then finally, on to civil society organizations. They are pivotal in advancing and sustaining momentum, and they advocate for equity and inclusion, but are often limited by restricted access to negotiations and inconsistent funding streams. And they're also very pivotal in terms of encouraging and sustaining actual actions on the ground. And so we have two civil society organizations written here, but of course there are many, many others that are all doing important work. So Healthcare Without Harm is looking more at sustainable healthcare, so how to bring the emissions from the healthcare sector down, considering the healthcare sector contributes to 5% of global emissions. And then the Global Climate and Health Alliance, which is a community, international community, and they do many things and produce many documents, and one of them is recommendations before each COP. So this was for COP29, but there's one for this year as well. So now we go on to the critiques of global governance of climate change and health. And what I'll say as well is we also call them cross-cutting themes, because you'll see that quite a few things that were found under one theme are transferable to the others. So we'll start with evidence generation to policy creation. And what the literature said is that the interlinkage between this isn't strong enough, and we need to improve this connection, because when policymakers are involved in the process from the beginning with researchers, the data tends to be more relevant for policy, and then the policy then is grounded in evidence, and then there's more chance of policy uptake and implementation and resources given towards it. The same is for if research is aligned with global frameworks. And then enhancing reliable long-term modeling methodologies. So the literature said that a lot of times different research comes to varying estimates. So there's a need to enhance reliable long-term methodologies and make them more accurate, because going back to before, we need to accurately quantify the co-benefits to get more resources and funding behind it. Generalizability we spoke about before. And then we have also the intersectoral collaboration. So you have climate and health research, and the literature says to increase that coordination to allow for knowledge sharing and decreased duplication of efforts. And then finally, greater policy coherence. So including climate and health in other policies, and not just in climate and health, but outside in other sectors as well, allowing for a more coordinated response towards climate health solutions. So now we go to framing climate issues through a health lens. So the literature said that this isn't done enough, although I would say it's definitely improving and changing, especially if we consider the beginning of the presentation. And so we start here with a health in all policies approach, which very much links to the cross-sectoral health and cross-sectoral policies. And when health is put in all policies, there's greater co-benefits and better resource allocation. Then health equity, which many studies spoke about, and some said health equity can't be achieved until environmental sustainability can be achieved, looking at the right to health and a right to a healthy environment. And other studies said, despite all the evidence to include health equity in these climate strategies, this has been very slow to materialize. And then the holistic approach, which includes health equity, but also public health lens and social determinants of health, all allow for a very comprehensive approach or response to climate health solutions. And demonstrating clear benefits, discussed before, and including climate change modules in healthcare education, medical education. This is also increasing around the world, and we find that when that is included, the healthcare professionals in their practice are more informed, and then they can educate their patients more about the effects of the health effects from climate change. And it also comes from a trusted source. And now we have financial and economic considerations, which the literature said they're not considered enough. They're underrepresented in both climate and health sectors, which isn't a surprise. And we start with the need to quantify economically the health co-benefits of these climate strategies. And the reason to do this is to try and encourage the prioritization of long-term public health. And a lot of these strategies that do prioritize long-term public health have a lot of upfront costs. So to have the data behind, but particularly the financial savings or long-term financial savings, is extremely important for policy uptake. And then innovative indicators and methodologies goes along the same theme, that we need these to be able to track the financial savings and then back up the policies. Funding difficulties, I think most people can relate to at the moment. In terms of what they're doing, COP28 had guiding principles for financing climate and health. COP29 discussed quite a lot of finance. I know now, next year, the Loss and Damage Fund will give out its first grants. So financial resources are being mobilized. I think it's just how quickly and what does that lead to. I guess we'll see. And then the literature talked about the need for more adaptable, flexible funds that are also easier to apply to, so that when they're on the ground, they can redirect more easily to the biggest public health benefit. And the literature said many times local stakeholder involvement. If you include local stakeholders, you have the success of the project is more likely as you're more aligned with community objectives. And then vested interests. So trying to redirect financial flows from health harming industries to prioritize public health. Again, very easy for me to say in this room, let's do it, but easier said than done. And that's why the evidence is so important when we're looking at climate and health. So now we go to strengthening global climate change and health governance through collaboration and strategic policy instruments. So here on the side, we have some examples of collaboration platforms. In the middle is their main function, and on the end are initiatives that are housed in these platforms. The functions in the middle are slightly different, of course, but the main overarching one is bringing climate and health sectors together and facilitating knowledge exchange. And if we go on to the next one, we have, firstly at the top here, the interlinkages between environmental sustainability and health equity. So it's what those platforms are trying to do, taking an ecological public health approach or a very holistic approach. What the literature does say, though, is that although these platforms foster cross-sectoral collaboration and allow for long-term planning, they're often hindered by inadequate funding, informal mandates, and lack of coherence across mechanisms. And then we go into including health in NAPs, National Adaptation Plans, and NDCs. So when health is included, it allows for strategies to be translated into actionable national interventions. And we found that countries that include health in their NAPs and NDCs were countries that suffered more from the effects of climate change, or countries that were low to medium Human Development Index countries. And then an example of this is the Caribbean small island developing states, where all 16 of them included health in their climate strategies, allowing for a cross-regional approach and policy coherence. Despite health being included in NAPs and NDCs, and when it is included, it lacks measurable health outcomes. So how to monitor and evaluate these health when health is included in these climate health solutions. And so the literature also said that we do need to improve and in our monitoring and evaluation of these health outcomes. And then finally, long-term modeling, which came up a lot in the literature. It's why you've seen it on many slides. So to use it as a strategic tool for cross-sectoral coordination, priority setting, policy planning, and examples of this now are the Climate Health and Global Heat Health Information Network. And what they do is that they allow access to climate data, and they allow for scenario-based planning using long-term modeling. And what the literature shows is that long-term modeling is really important for public health planning, informed decision-making, and resource allocation. So finally, we go on to the actionable recommendations. So to start off, mainstreaming health into climate policy instruments and financing structures, which I think is a pretty clear recommendation that comes out through the presentation. So including adopting a health in all policies approach, ensuring health equity is centralized in the NDCs and NAPs, and also embedding health priorities into funding criteria to improve transparency and accessibility, and all of this to allow for a more systematic approach to the health effects of climate change. Reinforcing institutional coordination and intergovernmental platforms. So here, trying to move from fragmented dialogue to more structured collaboration. So to reinforce formal coordination mechanisms, ensuring wider spread participation, and creating stronger linkages between informal alliances and intergovernmental processes. And here I'll also mention ensuring that there's more reciprocal representation at these processes, so more health representation at the yearly COPs, which there definitely is, but also ensuring that they have a voice and can contribute. And the same with the World Health Assembly each year, allowing for climate representation, which I think is quite low at the moment. And then investing in long-term modeling tools and robust data systems for climate health action. To improve the methodologies and incorporate health outcomes and economic losses to support policy uptake, and standardizing the metrics to allow for better monitoring and accountability. And we find that when these things are in place, that the capacity of institutions to deliver timely, coordinated data responses increases. But the literature also says that even if these are in place, their effectiveness is also often limited by systemic barriers, such as political will, institutional capacity, and resources. And finally, to establish clear accountability mechanisms to bridge the implementation gap. So incorporating measurable health objectives, allowing for the global governance systems to monitor and evaluate, and then establishing robust accountability mechanisms to create not only reporting obligations, but also a global governance function that builds trust, transparency, and long-term institutional effectiveness. And I will finish there, and that's why that is underlined. But thank you all for listening, and you can download the paper from this QR code.
Thank you, Eva. If we have some questions in the room, and then we'll go also online. Any question? Yes. Present, please, yourself.
Hi, I'm Ellen Ruskin from the Global Health Center. I have a bunch of questions. Can I bundle them? all in one so I don't come back and forth?
Sure.
You probably want to write them down or I can shoot them over to you.
Let me
Okay.
sit down. Okay.
First, I read your paper and I want to congratulate you in the biggest way because this was a tremendous work. And what I took away from this was, oh, wow, this is a PhD level literature review. This is the constant kind of monster literature review that is required for a PhD. And I know what it means to slog through that, and it seems like the stuff will never end. So congratulations for your
Thank you.
patience and diligence to get through it. It's not a fun task. Yes, I've been through it. My main takeaway from reading the paper was the mind-blowing fragmentation and the 33 years of like movement and not movement. And okay, so I'm going to dive into my questions. Is that okay with you?
Yeah.
Okay, so this is not a question, this is a statement. Research to policy is always a long and slow process. So that's a background caveat. What I see from all that is included in the paper based on the literature of the scientific work, and then what's happening in reality around the world today is 33 years, almost 30 COPs, enormous cost to do every COP. They're phenomenally expensive. And yet the leadership today in real action at country level seems to be coming from the periphery, not from these mechanisms. I'm not diminishing the importance at all of the governance through these multilateral and intergovernmental mechanisms. They're really important for inclusiveness. But in terms of country action, I mean, China is today the country doing the most fast forward to reduce emissions. And it's not through the COP process that they're doing this. But it's through green technology, entrepreneurship, and a number of countries are going fast forward. And my question on that, related to country action, is, would you say that these peripheral country fast forward movements are de facto leading to reducing health impacts without going through these multilateral governance processes? Does it happen simultaneously just as a natural effect of the work going on through technology and entrepreneurship? That's one. So 33 years, health came in as a focus rather late. And I know that the person, Maria Nera from WHO, took the lead on this work for WHO, that it took her 10 years of dedicated work, which is a quarter of a lifetime of work, to get health to be seen as a focal point. And in almost till 10 years in, health was like a background, a side issue. The environmental community didn't see it as a main entry point, a main point. And health wasn't even discussed in the main COP for us. It was like a side and a back issue, and they didn't even get to discuss it in the main plenaries. But by year 9 and 10, when this health pavilion, I mean, this was an enormous development, a decade though. So your slide that showed a little box that said health is the focal point in, what was the trigger to make that happen after a decade of WHO being at every COP and working on this and not getting the visibility, the upward movement? And would you say that now it is really widely accepted across all the diverse stakeholders engaged in the COP processes? More. Why has the environmental community resisted for so long to incorporate and see health as a central area of focus and component of climate change? And my last question is about language. would you say, based on all your analysis of the research, have the health and environment communities done a disservice to the forward movement in this area through the convoluted language over decades? And when you consider that there are changes in generations over 33 years, that there are a handful, very few people who have been a constant throughout 33 years who would even have an idea of the background, the history, the process. But the change in the terms, it's of course it loses people along the way, which isn't a good way to build activism and forward policy movement. So have we in the health community and the environment communities done ourselves a disservice? I'm done.
All right. Sorry. Should I answer them now?
Yes, I think.
So firstly, you're talking about country action, which is where it seems the main action is happening, instead of these global governance processes. I would agree that more action is being spurred on by country level, but you suggested that it might be because of technology and just natural advancement. But there are studies and evidence that from the Paris Agreement, without the Paris Agreement, we would be reaching 4 degrees, and now we're at maybe 2.8, 2.3, which still isn't good, but it raised awareness. So I think that probably spurred on the action. I think it's also that now green energy is now a lot cheaper, and especially as you mentioned, China, it's a market for them. They're the main producer of it, and they sell it to a lot of other countries. I can't say one or the other. A lot of your questions are very broad. I can't say one or the other. What was the trigger for the health focus in the UNFCCC? Again, I mean, the health pavilion in COP26 in Glasgow was a key moment, but as you say, it still was on the periphery. So including, I mean, it's the activism on the sidelines in WHO, but I can't say who and what the key moment was. And then in terms of doing a disservice doing a disservice, I don't know. I think it's also people doing the best they can. I mean, we're talking over 33 years, and in 1992, that was the way, let's create this treaty. And now, who's to say that there might be better ways, but this is the system that we have, that we need to make use of in some way. So yeah.
Do we have online questions? Yes, please.
Thank you, and congratulations. It's a great job. And the methodology, I think, is so good. For the review is strong. And that's it. It's my point about, did you review the progress of the inclusion of the health in climate policy? But do you identify that this progress is more a response institutional or related with maybe with change within the multilateral organizations, or to pressure from external actors such society, scientific hubs, etc.? Or maybe if it's only is related with the engagement of the countries, that maybe if it is correlated, that engage in health and also in climate change, or did you find any relation there?
Yes, actually, it's a good question. I think one of the big drivers was the civil society organizations and other activists. But you talked about countries. So, for example, the small island developing states, I think it was a 2023 study, but don't quote me on that. said that they were responsible for 57% of the climate talks in the UNFCCC. So there are definitely some groups of countries that are pushing it more, and I would say they have a big role to play in it. In terms of attach, and when that started, the 50 countries that made those commitments, they were seen as the countries as well that were moving towards climate health solutions. So I think it was a mix of everything, but I would say there was definitely some groups that encouraged to speak about it more. And also with the declaration on climate and health that happened at COP28, the countries that spurred that on, particularly from the Netherlands and Peru. So you've got, key countries, but then you really need the civil society organization to put the pressure and keep the momentum up, I would say.
So there's a question online that I'll read to you. It's from Edward Boydell, from Sun Movement, one of the partners of the Initiative on Climate Action and Nutrition, part of Attached. And the question is, what does the research say about the interplay between the global processes and national climate and health policy? And he's adding, our experience is that there is a dynamic interplay between the two, where we can use the global processes such as the updates to NDC 3.0 to integrate nutrition, and are now working to build a pipeline of climate finance and technical support to their implementation. So the question is, again, what does the research say about this interplay between global processes and national climate and health policy?
So I think I can't say the exact interplay. We would definitely look at the global level, but we also obviously include the national adaptation plans, which are at country level. And we found the countries that were including health and nutrition for the ICAN movement, it was easier for them to implement and to go in. And I think it really depends on if the countries are connecting their NDCs and NAPs. You said that you're using the 3.0 NDCs. I think the 3.0 NDCs also, I haven't looked at them all, but they've included health and nutrition and other aspects in quite a bigger regard. So I think in terms of an entry point, that would be the best way. And I think it depends on which countries have included health and nutrition, and then you can go into the national level as well.
Thank you. I have a question. I introduced myself in the beginning. I just wanted to ask you also from your research that you've done, did you see some, is there a research gap that other researchers will pick up and try to give an answer on several issues?
I mean, the main research gap that came out for us was the long-term modeling methodologies, which are improving every year as we go through. But and remembering this literature review was over 20 years, so including studies from the early 2000s as well. But the need to have methodologies that are more standard and comparable, so that it's easier to compare climate data. So I think if some researchers want to embark on that and find the right way, because it's tough as well, climate change science and health is changing so much, as reflected with the Lancet indicators as well. It's not an easy task to take on, but that would be one of the areas that comes to mind straight away.
Thank you. Thank you. Any other question? Yes, please.
I'm Anna. I am a visiting fellow at the Health Center. Very impressive results, first of all. I think one of my big questions in watching you present all this is, where do you see these governance changing over time? I mean, you've shown what's happened over the last 30 years, that we've seen more and more integration of health and climate. It sounds like, from what you presented, that this is going to just keep going towards greater and greater integration. Do you see any reason that it might actually start to bifurcate again? Like, do you think this will just continue being more interconnected, or do you see there being any stress points that might actually cause more splits in the future?
Great question as well. I think, as you say, it looks like it'll just keep going, and wouldn't that be great? I think we're also living in a time where there's a lot of powerful voices who are denying climate change, I'll say. So I think there's a real need as well to address misinformation and disinformation, which is spreading more now, despite the fact that the science is unequivocal from according to WHO, that climate change is causing these health effects. So I would like to say, yes, it keeps going, and even at a faster rate would be even better. But I mean, at the moment, we've also got this big issue that's growing that needs to be addressed. And again, I don't know how to address that, but the science and evidence is a way to start at least.
So congratulations. I want to echo what others have said. It's really a huge accomplishment, not just an amount of work, which is true, but I've been very happy to see the way the paper has evolved over the last year, I think, plus, since you and Laura really began this work to become, to offer really a much clearer set of final conclusions. And I think, to me, what's quite amazing is to see indeed this evolution over time, kind of rising on the health agenda of climate, so that you have rising on the global agenda, there's climate, but certainly rising on the health agenda. And I wanted to ask a question that really builds on, I think, Ellen, what you put on the table. Why was there this shift at a certain time? And I don't know the answer to that question, but I'm wondering, to what extent do you think the advancing science and research and the ability to actually link health effects to climate, what difference did that make? And what difference do you think it made that you had the scientific community also getting better organized? If we look at the Lancet, it's quite remarkable how the Lancet really jumps out. The countdown becomes its own arena in a way, its own actor, its own sort of subsystem. I think that's quite remarkable. To what extent is that sort of epistemic community, if you will, driving greater attention, greater mobilization, or do you see that as more of a reaction? But I would love to sort of hear your reflections about the intersection between the knowledge production, the knowledge community, and this more policy-oriented community where health was not prioritized for a long time. And I remember, I think one of the reasons I asked this is because at a very personal level, I remember hearing for a long time, yes, health and climate, but it's about mosquitoes. It was quite limited the way we understood the intersections, right? And so, yeah, mosquitoes are expanding and there's going to be more malaria. Okay, this is important, but it didn't rise to, heat, air pollution, vectors, agriculture, all of the different causal pathways through which health can be affected. So I think we've become more sophisticated in the way we understand it. And I'm wondering, what is the role of research of the research community in trying to, in making that possible in a way?
So I would say, I'd say the research community, I think, definitely spurred it on or had something to do with it. Because when I say studies went back to early 2000s and even before then. And you spoke about the Lancet. The Lancet actually came out with a study in 2009 recognizing the effects of climate change that climate change has on health. And that was also seen as a landmark study and tried to spur some action on. So I'd say the research has definitely spurred on action, and I think we can't forget the advocacy from civil society that's always been there. And then, as you say, I think as it's evolved, it's maybe both now, like what does policy need, which is also what the literature needs, and what can the data give. But as you say, you don't know the answer. I don't know the specific answer, but I would say, yeah, from the research.
Hi, my name is Bruna. I'm a visiting fellow here in ANSO department, and I live in Belém, and I study about climate change and health too. But congratulations about your research, it's fantastic. But I really wanted to know more about your opinion. What do you think of this solution that we can see in events like COPs? So if you can talk more about that.
Sorry, I don't. You mean how far can we advance with the COPs towards this? Yeah. So as I gave the example before, I mean, the Paris Agreement did spur on some action. So, I mean, that's a key example that it does work or that it does spur on action. How successful can we be? I don't know. I think the last two, I think there's been a lot of promises and delivering on them has not matched that. But as I said, this is the system that we have to make work. I think last year at the COP as well, there was a lot more attendance than this year I was reading. And this year really trying to focus on climate change and health and be the COP of implementation. And maybe that will be a turning point, which I'd love to see more action. My personal opinion though is, I don't know, maybe we need to restructure everything, but again, easy for me to say in this room. Yeah.
Thank you.
Yes, of course.
Sorry, I'm Juliana. I know Suli, that's thank you so much for this. I really wanted to hear your presentation, and apologies, I was a bit late. I don't know if you can answer this, but you did like a thorough research on climate change and health. And my question would be, because I've seen it from the perspective of WHO and a little bit from the climate change framework, who can deal with this? Is it WHO? Like WHO, would if WHO have the capacity to deal with climate change and health? Or should we frame this, because if we're framing it in the COP framework and UNFCCC treaties and Paris Agreement, should it be dealt via the Secretariat of the climate change treaties? Because what I guess is that they're not talking to each other, so we need to have like one structure or two structures that can lead these things. I don't know if you like have seen anything in the research that you did, because if nobody's leading this, it would be like just one point in the agenda.
Yeah, no, definitely. And I think as another theme that was mentioned many times, the cross-sectoral collaboration between the climate and health. I think it needs to be done in both. I mean, health now is being elevated more and more. And as I said before, hopefully at this COP30, it will increase. I think for WHO, they're also trying to recognize health more and more, especially with the new program of work. What we did find though is the representation at the World Health Assembly for climate representation there is a lot less than health representation at the yearly COPs. I know in saying that the COPs are a lot bigger, but I think having the other sectors' voices and their representation at the table and listening to them and giving their opinions on how to go forward. I think we can't rely on one. I think we have to enter wherever we can with the climate health solutions. But again, it could be anything. Yeah.
Thank you, Eva. We have a last question from online.
We have another question from Bianca Carvalho. Bianca was a master's student in global health track as well. I think you know her. So she's congratulating you for your paper, which we all are. And she's saying, as you mentioned, there are many limits and barriers for civil society organizations' access to negotiations. In light of what happened at the COP, where indigenous peoples enter the venue to demand to be heard, how can global governance frameworks evolve to institutionalize meaningful participation and power sharing with civil society and indigenous communities rather than maintaining symbolic inclusion?
Powerful question. But yes, of course, indigenous voices need to be at the table, and I think again, there's promises made each year, and if they're actually coming to fruition is a different thing. I mean, I can't say, the COP must include these voices, but of course they should. And again, it's easy for us to say this in this room, that of course there should be a voice from every single community there, and they should be able to have their say. But it's not like that. But it should be, and I think it's trying to change, but
Thank you. Thank you, Eva. Thank you for this recent timely presentation. And thank to you and your participation online and in the room. Our center is planning to engage more in the future on this subject, of course, with the lens of policy, power, and governance through our Governing Pandemic initiative. And I wanted to say that this is our last research cafe of this year. If you would like to keep yourselves updated, please visit our website. And you can find also from old recordings from past events. And at some point, this recording will be uploaded as well. You can, of course, keep yourselves updated with the newsletter to see when the recording will be up. I wanted to say before we close that also we have our Global Health Diplomacy course. The call for application is now open. And on our website, this is a training program for the Geneva Global Health Community focused on strengthening capacity in global health diplomacy, bringing together practitioners and diplomats who work at the interface of health and international relations. More details in the platform website and in our Global Health Center website. And we will be happy to see some of you there. Thank you again for joining us. And thank you, Eva, again. And I wish you a nice rest of the day. Okay.